Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Once again, some tremendous questions. I had somebody who has a fabulous chiropractor in Tennessee, which is also very good, and this individual has a family history of Parkinson's disease. They themselves have been diagnosed with Parkinson's disease and have realized that some of the body signals that they have suffered with the last several years have been directly related to Parkinson's disease. So in our practice, what we try to do is improve fat metabolism. And there's a product that we use called phosphatidylcholine. You could take anywhere from 3 to 6 of those every day. What I would also suggest that you do is have an essential fatty acid blood spot test done to look at the oils that are inside of your body, because your brain needs good oil. So wisely, I would do an essential fatty acid blood spot test. The phosphatidylcholine is very specific for helping what we call synapses. Synaptic are like the little electric junctions in your body. Would be a wise thing to do. Now, someone had the gallbladder out, they said about 5 years ago, and they've had terrible digestion with that. I want you to know that we have created a specific protocol for gallbladders, because 500,000 gallbladders come out every year. I talk about this in my book, Dr. Bob's Guide to Prevent Surgery. This is very serious. Your gallbladder is your reservoir of basically dish detergent in your body. When they take your gallbladder out, that's like me coming to your sink right now and taking away your dish detergent. You're going to have digestive distress. But there's a protocol that we use with a product called Beta Plus that helps promote bile in your body. We also use Beta TCP, which thins the bile, and a product called Livertrit, which is a proprietary herbal formula designed to support optimal liver function. You definitely would want to contact us. This is something that can be serious. What I've learned from my experience now is that individuals, and it's more common in women than men that have the gallbladders out, have a greater potential to have potentially heart challenges, and I've seen breast cancer a lot. Dr. Bob, is there a test besides a blood test for your thyroid? I have not seen it. We use a TSH, a T3, a T4, and a TPO. We basically follow the numbers. Dr. Bob, what's your take on supplementing with glutathione and doing a liver, kidney, flesh, or weight loss coupled with lean protein and vegetables? Well, I use basically a non-starchy vegetable diet myself with protein, just like you said. We have a product from Biotics Research Corporation called MCS2, which has glutathione in it, which helps phase 1 and phase 2 of detoxification. I also just did the weight loss detox with Biotics Research Corporation, and it really is tremendous. Is there a test for malaria with the urine, and is it curable? Quite honestly, I don't, and I have not studied enough about malaria. I did 40 years ago when I was taking classes in pathology, but it's not something that I commonly see in the cold Great Lakes region. So I wish I could help you more. You'd probably want to find someone who practices in areas that works with malaria on a regular basis. Interesting question. We don't get this very often. Dr. Bob, what is the best way to gain weight the healthy way? Well, you want to stay away from carbs. You don't want to be eating donuts and pasta. But we actually use something called Gallbladder Forte. I just had a young man who was like a sophomore, junior in high school, wanted to gain 15 pounds. And we use something called Gallbladder Forte, like I just mentioned, which has transferulic acid in it, helps build lean muscle tissue. This is also for the individuals who may have sore muscles when they wake up in the morning. Dr. Bob, what can I do about my toenail? I also talk about this in my new book, Dr. Bob's Guide to Prevent Surgery. A fungus toenail is usually a gut problem. Oftentimes you may in fact have parasites. And this is an interesting question. Follow-up is somebody else totally different. Hi Dr. Bob, I was wondering about your take on ADP, which is a product that I use, which is emulsified oregano and probiotics at the same time. Is it counterintuitive? Nice word, counterintuitive. See, ADP will literally kill everything in your gut. We have a protocol that we will add a probiotic 2 to 3 weeks into the care along with a product to clean your colon out. You always want to make sure that you have a sulfur-based diet when you're working on cleaning out your gut, because parasites do not like sulfur. Eggs, onion, garlic, broccoli, cabbage, and cauliflower. This is a very first type of question. It's very interesting. Dr. Bob, I saw you the first time today on Daystar, and you touched on something I've been suffering for 10 years. And recently I had my spine replaced, and I wasn't sure what that meant exactly. Medications should I take? Will not take anymore. Great pain on the left side. The surgeon admits he had to take a rib out. I have been worried about my liver, and I have a thyroid condition. Can you recommend a beginner's diet? I don't trust my doctors anymore. Okay, so here's what's going on. Just kind of listen to me. I have learned, and we talk about this in Dr. Bob's Guide to Prevent Surgery, so you really want to get this book. Left neck and mid-back pain, including ribs, can oftentimes be a referral from your gut, from your viscera, from your organs. And commonly left neck and mid-back pain is a pancreas referral. And if you've been eating cookies and pasta, not pasta, but pasta, yes, but cookies and chocolates, etc., it's going to aggravate your pancreas, causing that rib to be irritated. And I'm telling you, in the fall, when I have people that rake leaves, and let's just say they had a piece of pie or a cake, and then they eat some, and they go out and they rake leaves and they throw the rib out and they go to the hospital, and $15,000 later, they tell them that their heart's okay. They literally subluxate a rib. So whomever this is, her name was Brenda. I just hope that this will help make a difference. You'd probably be very wise to come and visit us over in Cleveland, Ohio, or in our Naples, Florida office. We're here to make a difference. My name is Dr. Bob DeMaria. Thank you so much.